This program is proudly brought to you by Daytech Limited and the National Information and Communications Technology Authority. In this session of Infocus, we hold discussions with Teresa Corazzi and Anne Clark. Both are from the Businesses for Health organization. We discuss the prevalence of tuberculosis in Papua New Guinea and the work its organization is doing to assist businesses as well as the society at large cope with and address the prevalence of tuberculosis. Teresa Corazzi and Anne Clark, thank you for joining us.
Thank you.
Now, firstly, Anne, can you briefly tell our viewers why we are facing on the current TB epidemic today and why World TB Day activities are planned here in NCD?
World Tuberculosis Day, with very high numbers of TB, it's actually TB Day every day in Papua New Guinea, but we use the 24th of March as a focal point for getting people to raise awareness, to become more aware of the problem. And for us, it's a bit like the start of the year, of the season. For us, it's a season opener for trying to engage businesses in the programs that we run and to highlight the burden that TB places on people, profits, productivity, and PNG's economy and the competitiveness of Papua New Guinea.
Could you tell us a bit about your organization, Businesses for Health?
For sure. Businesses for Health was established because of the huge rise in numbers of cases of tuberculosis. And so back in 2016-17, Dr. Dakalala, the then Deputy Secretary for Health, had watched what the business community had done in relation to the HIV epidemic earlier in the 2000s. So he desperately wanted all hands on deck to deal with this huge growing problem of tuberculosis. Back in 2016, we were looking at 30-something thousand cases of TB, and that was catastrophic. So he came to the business community and said, will the business community support a small project like you did with the Business Coalition on HIV in the early 2000s to respond to a public health emergency? That emergency at that time was TB. We called ourselves the Businesses for Health because tuberculosis is a disease that is driven by so many health issues. Poor diet, smoking, high blood pressure, HIV, lack of physical activity, obesity, poor air quality, poor ventilation, all of the health issues in the workplace. So poor health factors help to drive high rates of tuberculosis. So we called ourselves the Businesses for Health, and our target was reducing the burden TB places on businesses, people, and obviously productivity and the competitiveness of businesses here in Papua New Guinea.
Now, recently you hosted a public display which we used 2,100 balloons. Can you explain what that installation represents and why you chose this visual?
Papua New Guineans are visual talkers, and Pidgin is the best visual descriptor language. So we was like, let's keep this simple. We wanted a message that wasn't aspirational, it wasn't some crazy convoluted message. We wanted to give a simple fact about TB that is largely misunderstood, and that was, or is, TB is airborne. So we sat around for hours dreaming up how do we best represent this, and our focal point for industry and commerce in Papua New Guinea is the roundabout as you come into downtown Port Moresby. So we wrote to the city manager and we said, this is what we want to do. We want to describe TB is airborne for everybody who comes into the city on Tuesday, March the 24th. Then we had to find someone to sponsor the helium to hold all the balloons up. So we went to our friends at BOC and said, how much gas do we need? Well, we nearly passed out when we found out how much helium cost. But we discussed it with our friends at BOC, and who, of course, work to manage TB in their workplace as well. And they decided that they would sponsor the helium for our display. So we had our first barrier was overcome. We had the helium, we had the vision, and we had the message. And bit by bit by bit, with all of the friends that we have around town, we put together that display. The colours of the balloons, and I'm sorry you didn't scan the code and do the quiz, because there was an online quiz to ask you what do the colours of the balloons represent. The colours of the balloon were the colours of the diagnostic sputum chart. So the balloons were chosen specifically to represent sputum or CUS, that when you cough, depending on the colour, it may indicate a certain level of disease. So many of the balloons were white and clear, healthy lungs. Some of the balloons were yellow and green, which is a sign of yellow being an infection, green being clearly a very poor infection. Some of the balloons were pink, which means blood may be circulating in the sputum, but this is a very bad thing if it's pink and frothy. If there's dark red balloons, indicates dried blood or blood actually in the sores of the lungs. And black, which may be a sign of cancer, pollution, smoking, and dead cells in the system. So whilst the display was very pretty, the colours were very strategically chosen.
Now, Teresa, many people misunderstand how tuberculosis spreads. Can you explain simply how someone can get TB?
So very simply, and there's a lot of misconception around how TB is spread, and like we want to thank you for getting us here we will address those misconceptions. So very simply, and there's only one way where TB can be spread, and that's when somebody who has TB of the lungs. So on my shirt you have here lungs, a representation of lungs, and you can see that there's one lung that's all black and the other one that has holes in them which represent like sores. So that's what the bacteria does when we breathe it in. So TB is spread when somebody who has tuberculosis spreads the Mycobacterium tuberculosis, that's the name of the bacteria that causes the disease, coughs it up into the air, and when another person breathes it in, that's how they transmit tuberculosis. So at first the bacteria enters through, like you breathe it in, and it enters the lungs and it causes the sores in the lungs. So when the lungs are sore, you have this tendency to cough. So you cough and you cough up sputum or CUS. And when somebody doesn't get treated, the sores become more. And if the disease stays on longer, the person tends to cough up CUS mixed with blood. And that's how we did the balloon representation to get people to understand. So very simply, it's an airborne disease. It can only spread when somebody who has TB coughs it up. But another thing that I want to highlight here is, so there's two factors to that. The person with TB who coughs up the bacteria and the environment. So if the place that we are in is poorly ventilated, then it promotes the bacteria. When somebody coughs it up, it can stay as long as it wants to stay in the air.
What preventive measures should people be undertaking?
So we say if it's a spread through cough, then one of the most important ways where we can prevent cough is if we are coughing, we cover our cough. So the first lesson that we give to our children, and children are very good in accepting little lessons like this, is cover your cough with your elbow, which is the correct way of covering your cough. So that's one of our first lessons that we give to people in public and in workplaces. So cover your cough with your elbow. And we promote that everywhere we go in our Cover Your Cough shirts to cover our cough properly. And that is with our elbow without our hands touching it. Keep your hands away. And remember I said two things. The person with TB who is coughing it up, plus the space that you are in. Poorly ventilated spaces, no proper sunlight, no fresh air. That promotes the bacteria to stay a very long time in the air. And many people ask, how long does the TB bacteria stay in the air? And the answer to that is, so long as the person who is coughing does not cover his cough, he still coughs up the bacteria. And the space is poorly ventilated. So the lesson is cover our cough, preventing that cough to spread. And of course that will go on to us discussing about, like, when do you go to check for that cough? And it's as soon as possible.
There's a perception that if you use the same utensils used by someone that has tuberculosis, that tuberculosis can spread through that way.
Oh, that's our favourite conversation. A person is more vulnerable to becoming sick with TB if they're unhealthy in all sorts of other ways. So if you don't wash your hands and you haven't been vaccinated and someone's got salmonella, worms, typhoid, and all of those horrible diseases that are spread so easily through dirty hands or dirty water, they make you sick, definitely. But the only way you can get TB is by breathing it in. So in Australia and in the NRL, use the coach, you know, the guy runs on with a bag of water bottles. No one shares water bottles. That's not so that they don't get TB, that's so that they don't get meningitis, the flu. Any waterborne or contact germ can be spread in the water, but not TB.
Now, is tuberculosis only a problem for people who have it, perhaps through genetic, or can anyone get it?
Maybe I'll start and Teresa will finish. Anyone can get tuberculosis if you walked into the lift at the top floor of the most expensive hotel or fancy law firm. If someone got into the lift and coughed and you were the next person in the lift and you breathed it in, anyone can get TB. The difference is whether or not that person is very well, eats well, wasn't exposed to it every day. But my grandfather died of tuberculosis in 1934. And I'm not expected to die of tuberculosis because my grandfather died of tuberculosis. When my grandfather died of tuberculosis, there was no treatment and people were sent off to the highlands to eat fresh vegetables, and that was the best that we could possibly do. Now in 2026, nearly 100 years later, we have all of the treatment and things to make sure that those things can be treated. The situation here in Papua New Guinea is very easy to confuse with families, and Teresa's got several examples to explain that.
So one of the things that promotes, we said anyone can get TB, but you know, in Papua New Guinea homes, we have a lot of family members and extended family members, which is very common in our PNG homes. People coming from the village or people transiting through the towns. And we have lots of families living in together, so we have overcrowding in our homes. So if somebody who has the infectious type of TB, which is TB of the lungs, who coughs up, you just imagine the number of people who are overcrowded, and if the houses are not ventilated properly, then that's how the disease transmits very quickly. The other thing is, still with overcrowding, you know very well that we have houses that are close together, especially in the settlements where you have houses that are not planned properly and people build, and the houses are close to each other, and you have poor ventilation in those houses too as well. So it's overcrowding in our homes, wherever that house may be in town or it's somewhere in the settlement. We tend to think that tuberculosis is sick blow settlement was a disease that's associated with people being poor. So overcrowding is one. So that means if our houses are overcrowded, if we walk into a marketplace that's overcrowded. So now we're touching into something that's also another thing that's common in PNG is we chew and smoke a lot. So if we stand in, you know, those wide stalls, and if somebody is coughing and you have a lot of people around, then they can spread TB in that way. So overcrowding in our homes, or you're walking into buildings that are overcrowded, then it's an infectious disease. It's airborne. That's the only way that TB is spread.
Now, and given that there is a lot of stigma associated with people that are living with tuberculosis, many people feel ashamed to come out and talk about it. How do we change that attitude in our communities?
Attitudes are the last thing and hardest thing to change. It takes time, and changing attitudes starts with the very earliest forms of community-based education close to home. So when little children and their mums all understand the importance of good health early, we understand how things are transmitted, we understand how things are prevented. So it's easy to say, oh, ignorance drives stigma, and ignorance drives shame, and ignorance drives discrimination. But our solution is to provide simple, clear messages at the place where they make the difference. And Teresa has already said how welcome and how vibrant children's minds are. Children in Australia, for example, are the children who have driven recycling. Children drive their parents not to smoke. So what can we do at the lowest level in the community to drive behaviour change from before children even start school? Community health posts, nurse educators in the community, so that when people come to the workplace can reinforce the attitudes that are being driven by the community. I've just described the ideal. So how do we prevent shame in the workplace? People are embarrassed, and as Teresa said, people become embarrassed if people think only poor people get TB. Now, if that's a prevailing attitude, then it's very hard to ask for help. So what we at Businesses for Health are trying to do is to drive workplace environments and the workplace culture that is an obvious climate of care and looking out for each other, to enable them to ask for help, to ensure that they understand how they will not lose their job if they put their hand up and ask for help. Back in the early 2000s, when we had that first, we'd never seen this thing called HIV before, and people were terrified because there was no treatment and testing was very difficult. So there's a little bit of the shame and embarrassment and the stigma sort of falls around TB and HIV, because when someone looks very sick and they say, oh, I'm sick AIDS, well, hang on a second, it might be tuberculosis. But if people think there's the shame associated with a sexually transmitted infection, we worked against that very successfully many years ago. But lots of those programs have fallen by the wayside. So making sure that in the workplace people are reinforced on that basic information, but that the climate says and the workplace culture says, we're here to help you, you will not be sacked, you will not be cut off from your income, and that we will support you and your family to make sure that you are included in testing and treatment, and access to those services is free. So it's easy to hide when you're embarrassed, you don't have any money, you think it might be a sexually transmitted infections, and all of those things that our culture makes us scared to talk about. And that's not just Papua New Guineans who are scared to talk about illness being a sign of shame. But it starts with good education, and it's reinforced by good workplace education programs.
Now, Teresa, what should friends, co-workers or family members say or do when someone is diagnosed with tuberculosis?
So I was reflecting on what Dr. N was saying, and just looking back in what's common in our families. So here in Papua New Guinea, we still maintain that family and that culture of being together as a family, which is good. So then the message is, we are seeing that we have gene expert machines, the machines that can detect tuberculosis. We have medicine that's provided by our government, which is free. So free testing, free medication. But the issue is, we're not going in early to get tested. So people, because of the shame and we tend to think that, oh, it's a disease of the poor. Or, people know that it's infectious. TB can be spread from one person to another. So if only we maintain that culture of being together and supporting each other when it comes to TB, I think we will be able to eradicate that stigma of that shame, or it's a disease of the poor. So for families back at home, if we see somebody who is losing weight, which is a sign of TB, so the common signs of tuberculosis are losing weight, and first of all, this person is coughing for more than 2 weeks. If they're losing weight, they have a fever. For children, we know children are always happy and they love to play. So if they're not as active as they usually are, then that's an indicator of they might have TB. So the best thing that we should do as individuals is recognize the signs of TB, and if we recognize it, instead of not doing anything, get that person to the clinic. So the TB facilities in NCD and in all our provinces, they are provided for free. So get this person to go in and test their coughs. It might be something, it might be not TB, it might be pneumonia that's not treated properly. So getting that person to early to be tested and to be treated. TB is a curable disease. With consistent treatment, taking the medications daily until the prescribed time, then it is curable. So acting earlier, not looking at a person who is coughing and neglecting them. We don't want that to happen.
Now, finally, Teresa, what kinds of training or support can businesses get for Businesses for Health?
I'll let Dr. N.
Teresa does all of the hard work. So fundamentally, our training tries to address at the very highest level of the business that TB is a serious issue and is the responsibility of all businesses operating here in Papua New Guinea to address Papua New Guinea's most deadly infectious disease. So if you're operating a business here, you have a responsibility to address this infection. Second of all, creating an environment where people have focal points and nice, kind people that can support you along a long and complex pathway to getting tested and cured. So if tuberculosis is painted as something that, you just go down there and you take a Panadol for 4 hours and you'll be back right tomorrow, this is a misunderstanding. So everybody at every level of the business has to understand that they were asking people to participate in a complex process. And that's what Teresa spends 5 days a week, every single day, morning, noon and night, getting messages from people who get lost along the way or who need help to get into the process. So our training fundamentally addresses creating focal points within the business where I can ask questions and seek support. We know that people, if they're dropped off at the end of the street, will not walk in to the TB clinic. They will run away and hide. So having someone in the workplace who knows and understands complex clinical pathways, who works in an environment that can support them to get back to work. And now I'm going to hand it over to Teresa because that's what she actually does every day of the week.
So for many workers in Papua New Guinea, they get afraid when they have tuberculosis. So the thing is, the first thing that comes to their mind is, I'm going to lose my job. My boss is going to fire me because I have tuberculosis. So in the workplaces, we want to make it be seen that when somebody has tuberculosis, they get treated for it and they get cured. So we provide the support to that person by making sure they know where to go to get the right medication and also getting back to work. So many times we think that if we have TB, that's it, we lose our job. We stay away for 6 months and 9 months or 2 years if it's multi-drug resistant TB. But that doesn't have to be. The least time that the number of days that workers can stay away from duties is 2 weeks. So if they have the right documentation and if they have stopped coughing, remember it's the coughing that spreads the disease. So if I'm not coughing, if I'm consistent to my treatment, then I can go back to work if I have the declaration from my TB doctor or the TB clinician that says I'm okay to go back to work. So we felt so many workers go back to work. They didn't need to stay away from their jobs for the whole of the length of that treatment, 6 months and 9 months.
The difficulty with that process is convincing the boss as well as convincing the colleagues. So everybody in the workplace has to know and understand to welcome people back to work and to support their colleagues, perhaps taking time off work if they're not well. And that's a real culture shift.
Teresa Koratsi and Anne Clark, thank you for joining us.
Thank you very much.
Thank you.
Well, viewers, that ends this episode of Infocus. Do join us again next week, Monday, on our regular time slot of 7 p.m. Till then, good night.
This program was proudly brought to you by Daytech Limited and the National Information and Communications Technology Authority.